Hello, hope you can hear me okay. Welcome to day 2 of my 20 days of positive birth tips for December. So if you have missed yesterday, I talked about pelvic movement and the importance of staying off your back, specifically staying off your sacrum in labour, because this lovely piece of your pelvis is designed to move. It's designed to get out of the way as much as possible for your baby to be born, and staying off your back can give you 30% more room for baby to get out. So I covered what to do on the ball yesterday, so if you missed that, do go back and check it out. It's on my grid. But today I want to talk about what you do if you're on the bed. If you either just want to be on the bed because you're tired or whatever, or if you've had an epidural and you've no choice but you have to stay in the bed. That doesn't mean that you have to lie on your back and restrict that sacrum from moving. You can go on your side or use a peanut ball, which I'm going to show you now, to really help your pelvis stay open, stay mobile. And if you watched me yesterday, you'll know that that's really important for trying to make your labour shorter and easier, and give your baby the best chance of getting out of your pelvis without getting stuck. So if you're going to be on the bed, whether you're having an epidural or not, this is your friend. This is a peanut ball. The majority of labour wards, maternity units have these, but do ask coming up to your labour to see if they have them. But they should all have these, because there's a lot of research around peanut ball use now, and it does show that they help keep your pelvis open, they help make your labour shorter, and if you're having an epidural, for example, it's known that your labour can slow down, so peanut ball can really help that and help reduce the risk of needing any kind of assistance in labour, like vacuum or forceps or whatever, because it helps keep that pelvis open and mobile and helps try and prevent baby from getting stuck, essentially. So this is it, shaped like a peanut. I'm going to jump on my bed now and show you what you can do with it. Essentially, lying on your side, you can either have one leg over it with the lower leg straight, or you can put 2 legs and put your peanut ball between them. So you would do this for maybe 10 or 15 minutes, and then you would swap over and do the other side, and then go back again. If you have an epidural, obviously you're going to need some help to do that swapping over, but your midwife and your partner can do that. One thing about the side lying, if you watched me yesterday, I talked about the importance of having your knees in and your calves out when you've reached the pushing stage. So when you get to that stage, what you can do is roll your peanut ball down. You can see this. So roll your peanut ball down to your ankles, put it between your ankles, and you can see that now. My knees are in, my calves are out. I can push, baby can come out here behind me, but it really helps open up those bones there in the back of your pelvis. So you can do knees and calves out in an epidural situation or on the bed situation with your peanut. Just roll that ball down to your ankles. The other thing you can do, if you want to be sitting up, is you can put one leg over it, you can put both legs over. If you're doing one leg, I would swap it back and forth, and your partner can even be doing a little bit of rocking as well, which is really nice to try and, again, keep that pelvis mobile. So you can use one leg, as I say, or both legs. The other handy thing that you can do, if you have enough, if you have enough mobility in your legs near the end of labour, so if you get to the pushing stage and you want to get up on all fours, which again can be really beneficial, we talked about this yesterday, to give that sacrum lots of room, you can ask for your epidural to be dialed back, and hopefully you'll get enough mobility in your legs to get yourself turned around, which I'm going to do, so that you can lean on your headboard and be kneeling. And what you can do, actually, if I can get this around behind me, is you can bit more stability, a little bit more support if you are going up on your knees. Obviously your partner, your midwife would be either side of you too normally, just in case you have a wobble, but the peanut ball can be really, really useful to give you that little bit of extra stability and support. So yeah, that's the peanut ball. As I say, whoa, don't drop it. As I said, majority of maternity units that I'm aware of have them, but you gotta ask. A lot of times they sit in cupboards, and unless you know to ask about them, they don't give them to you. So if you're going in to your antenatal clinics, first of all, ask, are they there? Is there peanut balls available? If not, can I bring my own? You can buy these on Amazon and online or whatever, but again, some hospitals have policies about whether you can bring in your own inflatables or not. So yeah, ask at an antenatal appointment, do you have them? Are they available? Yes, if they are. If they're not, can I bring my own? They're not expensive things. But definitely, if you feel you're going to be on the bed, if you feel you're going to have an epidural, ask for a peanut ball. It can be a really, really useful tool to use in labour. So that's it. That's my tip for today. Hope to see you tomorrow for day 3.